So the pneumonia pathway is only for patients who have a diagnosis of pneumonia. The pathway is actually an order set that the provider will order, and it's either done on admission or during the patient's stay. It just depends on when the confirmation of the pneumonia diagnosis is made. And what's the purpose of this pathway? It's to streamline care, making sure that the pneumonia patient is receiving all the essential orders for the treatment of pneumonia, and to also decrease the length of stay from 8 days to around 4 to 5 days. So how do I know my patient is on the pathway? Well, it's really simple. You're just going to go into Epic, and then you're going to go into the patient's chart and go to the summary tab. And if you see this pink banner right over here that says Pneumonia Pathway, that's how you know. And the cool thing about this banner is that it's just not, informational. It just doesn't tell you that the patient's on the pathway. You could actually click on this banner and will take you to the pathway itself. And here's the pneumonia pathway. Essentially what the pathway is 2 lists of outcomes that need to be completed. So over here is one list, and over here is the second list. Now this first list. These are the outcomes for the acute phase of treatment for pneumonia, and the second list is the outcomes of treatment for the recovery phase. Now, the cool thing about these 2 lists is that they're informational and actionable. Now, informational meaning that, it's a list and we could see that these are things that we need to complete, but the great thing is that it's actionable, meaning that if you click on one of these items, it will take you to the correct flow sheet to complete that item. Now, regarding outcomes, the only outcomes that nurses need to worry about are the ones that are labeled all and RN. If you see an outcome that's labeled SW, MD, or PT, don't worry about those. Again, nurses only worry about outcomes labeled all and RN. Now, what I want you to note on each list is that there's a not completed side and a completed side. Now, the goal, of course, is to make sure that these outcomes are completed by documenting in the appropriate flow sheet. So when you do document appropriately, these outcomes will move automatically to the completed side. Now, let's say you're having difficulty completing an outcome. To get help, you simply have to hover over an outcome and a pop-up will appear. And this pop-up will provide a tip on how to complete the outcome. Now, what are headings? Well, headings appear over outcomes, and basically they let you know the status of an outcome. What I like to use headings for is just to let me know if an outcome is overdue. Now, there's different types of headings. If you see a white clock, just like this one, it means the outcome is not complete. If you see a yellow clock, that means it's about to be overdue. If you see a red clock, just like this one, it means the item is overdue. And if you see a green check, that means that the item is completed. Now, I like to emphasize that the pneumonia pathway is organized into 2 lists, an acute phase and a recovery phase. Now, you don't need to move your patient from one phase to the other. All the documentation that you do for your patient will go towards all the outcomes in either list. As we can see here, we don't have the pneumonia pathway on our patient list. So how do we add it? Really simple. You're going to highlight your list, you're going to go to More, you're going to go to Edit List, and then we're going to go to Properties. After that, we're going to search for the pneumonia pathway by typing in PNA, and then you'll see the pneumonia pathway for the acute phase, and if we click down, the recovery phase. So we're going to add both of these. You simply just highlight one and add it, highlight the second, then add it, and you'll see on this bottom portion that it was added to the end of our list. So if we press accept, you'll see that the pneumonia pathway was added to the end of our list right over here. Now, a quick way to see if your patient is on the pneumonia pathway is to go to the columns. If you see a clock in both of these columns, then you know the patient is on the pathway.